All right, welcome back to ABA exam review and the continuation of our BCBA 5th edition task list series. We're continuing with selecting and implementing interventions. H4, selecting appropriate alternative behaviors. By now, we've chosen target behaviors due to social validity and history and other things. And now what we want to do when we are decreasing behavior, we want to try to replace those behaviors because those behaviors are serving a purpose. And if we are removing a client's ability to meet a goal or meet a need, we have to give them another way to meet that same need. So we're going to go through each idea in H4. Not a complex topic because it's just building on what we've already talked about in H. But as always, we're going to boil it down and keep it simple. Be sure to subscribe if you haven't already. We would really appreciate it. Check out behavioranalyststudy.com for all of our study materials. When you pass your exam, please let us know so we can include you in the Sunday shout out. We are starting our 6th edition task list right after we're done with this, so look out for that. Other than that, work hard, study hard, and let's get going. Okay, so we're selecting appropriate alternative behaviors. And what we're really going to talk about is the need for alternative behaviors and why we do it. Selecting appropriate behaviors is really not much different than how we go about selecting our initial target behaviors. And so the idea to start is whenever you decrease or remove a behavior, you should replace that behavior because those behaviors serve a function. So we're thinking about the fair pair rule, where if I remove something from you that you use to gain access to something or get rid of something, I need to do the right thing and give you another way to gain access or get rid of that thing. Because the idea is if we don't, then another behavior may take its place. And so if we have a client who screams to get what they want, let's say we decrease the screaming and we don't give an alternative. Well, if we don't give an alternative, something's going to replace the screaming or the screaming is just going to come back. And so we might as well take control of that situation and choose what exactly is going to replace that screaming. And that goes for all of the target behaviors we're choosing. Our alternative behaviors need to be socially valid. They need to be meaningful, just like any behavior we choose. And we want the behaviors to make sense in a generalized setting. So you got to think about, what am I replacing this behavior with? Does it make sense for their day-to-day life? Is it going to add value to their life? Is it going to be meaningful in their life? And then good alternative behaviors reduces the need for punishment and punitive reactive strategies. Now, of course, you as the analyst should never be punitively reacting, and we want to try to limit punishment, but things happen and sometimes punishment may be necessary. If we can choose really good alternative behaviors, we may do our client a favor and reduce punishment and punitive reactions from the generalized population. So what should an acceptable alternative behavior possess? What kind of qualities? Well, first, you want them to be functionally equivalent. If we're decreasing a behavior that functions for escape, it doesn't make a lot of sense to replace it with the behavior that functions for attention, because we want behaviors that are meeting the same goal and serving the same need. 2, we want something that's achievable. Can you teach the alternative behavior? Can the person learn the alternative? You might have a great alternative behavior, but if it can't be taught and it can't be learned, well, you're going to have to go a different route. And then 3, contextually appropriate. Does the behavior fit into our desired context? What we're teaching, does it work where the client lives? If they spend a lot of their day at school, is that behavior okay at school? And that's something you have to consider if you're working in different environments. So if you're working in a clinic, let's say, you got to be careful about what behaviors you're going to teach that may be okay in your clinic, because you got to think they still have to go to school, they've got to go to home, they've got to go to social settings. So what behaviors are you teaching, and are they contextually appropriate where that person is going to be functioning? And just some additional ideas. Alternative behaviors should be chosen in the same fashion that we choose target behaviors. Careful assessment and analysis. So functional behavior assessments need to be done. You've got to think about all these things. What does the ecological assessment say? What about the people around the client? Is this alternative behavior the best possible replacement for what I'm removing? Think about DRAs and DRIs, so differential reinforcements of alternative incompatible. These are really the standard and what we often use where we're putting something on extinction and then replacing it with an alternative or incompatible behavior. If you are using punishment, because we are decreasing behaviors in the case, you've got to think about what purpose does the punished behavior serves. Just because it's a problem behavior doesn't mean it's useless, doesn't mean it doesn't have a function. Again, back to our screaming example. Yes, screaming is probably not socially valid, but if it's meeting a need, you've got to think about that. And then how can you incorporate reinforcement into your treatment plan? When we're talking about decreasing behavior through punishment or extinction, that's great and it might be effective, but how can we also get some reinforcement in there? How can we start to increase better behavior? Thank you for watching. Check out behavioranalyststudy.com for all of our study materials. Subscribe if you haven't already. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. We'll see you soon.